Let's start off with the incision. So there are, in this case, about 4 or 5 small little holes, and that's typically what we see. They're a little bit red. So as far as caring for the wound afterwards, you're allowed to shower usually within about 3 days. And after you shower, we ask that you use a little peroxide, and then you can use just little band-aids afterwards to cover the incisions. If you see any drainage, then let us know. So that's pretty much it as far as the incisions go. We don't mind you covering them with little band-aids at about the 3rd day. We take the dressing off at that time as well too. Now, if you pull back just a little bit, you're going to see what we see here is very commonly what we see after surgery. There's some issues with how the sling is being used. We're going to go over them one at a time. I'm going to start with the sling part actually here. Now, the idea of this video is to really help to educate you on how you can avoid injuring the rotator cuff. In order for it to have the maximum amount of success, because we've linked the tendon to the bone, we know that this pillow, by bringing the arm away from the body, is relaxing the rotator cuff. So there is an optimal position that we know will allow the best success after rotator cuff repair. So first of all, when you're looking at the sling, we want to have the elbow sitting right in the back here. So you want to gently get that elbow sitting right at the back. We want to get this strap right over here. And now where the whole sling sits is gonna help as well too. So we want this sitting, come around the back over here. We want this sitting slightly forward. So if your back is to the wall, the elbow, it's okay, you can leave this like that. If your back is to the wall, the elbow needs to be about 30 degrees in front of that. That's the natural position. It should look natural. The other thing we're noticing over here is if we come around the front, we're going to see that the right shoulder is drooping just a little bit. So we're going to have you pinch your shoulder blades back. So come back around over here. We're going to see we're going to have them pinch your shoulder blades back right over here. One of the biggest mistakes people make is they keep the strap on a little bit loose. The arm hangs down. So we want to engage the shoulder blades a little bit here. Relax this muscle over here. And when you pull back, and we come back around the front over here, come back around the front, we're going to see that the shoulders are now just a little bit more level. And that's the ideal natural position. What we're looking for is a natural position. What we're not trying to do is have it feel very unnatural. The other thing is we notice the straps are not quite working as ideally as they should. You generally want the arm to feel like it's being cradled. And what I find some people will do, they'll either over-tighten it or under-tighten it. It's one of the most common reasons for having significant pain right after the surgery. Sometimes it's too loose. And what happens is we instinctually will tighten up these muscles here, and people come in and say, I'm really having severe pain, right? So what we then do is we take this part right over here, this strap here, strap right here, and we adjust it so that it's crossing the shoulder blade. It's crossing the shoulder blade, but it's actually laying right here on the neck. Because one of the other problems we see is people start to get some neck irritation here from the sling digging in. So we pull it back down a little bit, and then if we come around the front, then we really look and we see how does that feel. And we ask how that feels, and if it feels just right, we'll leave it alone. If not, we can come around over here, and we can adjust this, either this strap here, we tighten the Velcro, we can tighten the Velcro just a little bit, over here if we need to, or we can come around over here, we can tighten this side as well too, and it doesn't really matter. There's a side right here, there's a side right there. You don't usually need to do these routinely, you usually do this at the beginning, and we see that should feel relatively okay, right? So that's feeling a little bit better, and so we position the sling so it's about 30 degrees forward, the shoulder blades pinch back, we see the shoulders are nice and level, and then what about this pillow? Now the problems we see with the pillow are often related to this Velcro down here. If we look down over here, we're going to see that there's a Velcro right here. I have your arm right now, I won't let go. The Velcro, you want that to sit right in the middle. Sometimes it goes forward, sometimes it goes back. We very often will see this slide forward, slide back, sometimes it slides out. Okay? It's very critical that this pillow is laying directly right underneath the sling, and it's laying just like that. So in a perfect world, we want the back of the sling to be close to the back of the pillow. And if we look at it from down on this side, you can see that the pillow is creating a wedge effect where it's wedging the arm away from the body, and that really helps us to detension the rotator cuff here. One of the key things to remember is there are some people who will tell me, I took the pillow out when I'm sleeping. A key element of this whole situation is realize that when you're awake, you have much more of an ability to control where this is at. When you're sleeping, if you take this off, there is science that tells us that when the arm is down at the side, especially in the early phase of a rotator cuff repair, that puts a lot of tension of the rotator cuff. So if you have to sleep with this thing off, then we ask that you put at least a pillow or two in between to achieve the same effect. If you notice, this looks very, very natural. It's sitting in the front. The strap is off the neck. The shoulders are level. The shoulder blade is pinched back. It's a little bit forward. We have a nice detension repair over here. Now, one of the things that we allow is people will sometimes complain of difficulty with this elbow in the sling. What we sometimes will do is we'll allow just what I just did. Undo the hook here. You undo the hook here, and you can very carefully take the arm. No, you don't want to do any tensions. You want to keep the tension off over here. But we will allow just a little bit of movement here if you need to. That allows the elbow a little bit of freedom and keeps people from sometimes getting some pressure issues here. Sometimes the nerve can get a little bit irritated. So we're okay with that. We're okay with you using your hand. We're okay with you using your wrist. We're okay with you using the elbow just a little. Is there any questions to ask? If we do biceps repairs, we'll sometimes minimize the tension on the elbow, but otherwise that's okay. Now, these little straps inside here are for the thumb. Not everybody likes these, but if you choose to use these, you want to make sure that you put them on so that it's covering the thumb. So we have to carefully Velcro this back. And there's some that actually like this because it helps keep the hand in position, and some really hate it. So that's one way of at least making sure that this doesn't slide out, because we find that the elbow does sometimes slide away. Whenever you're done, you can very carefully just strap this thing back on with both of these buckles. Now the other thing is, what about showering? People ask about showering a lot. When you shower, it's very important to achieve the same concept. The concept is detension the rotator cuff so that you protect the repair. That has to be going on 24/7 for the first 4 to 6 weeks. So you can't take it off every once in a while, because that is going against the concept we're talking about. So if you have to shower, you have to very carefully avoid any contraction here. So if there's one point I want to make over and over again, is you're avoiding any excessive tension on the cuff repair. And so when you do that, you need someone to help you. Ideally, you take this off, you undo these straps, you very carefully, don't do it on your own, you very carefully lift the arm up, take this away, undo the strap over here, and ideally if you have any kind of inflatable device, whether it's a beach ball, inflate that to the size of this pillow and very carefully lay it under there and get into the shower, and then do the same in reverse. I think that's a good way.
Right.
So we want to minimize any shoulder contraction. The reason being, there are many studies that have been done that show actually even using the other arm in a ballistic quick fashion will reciprocally fire this side, which means it's very hard to not use the shoulder.
Yeah.
We're asking you to do something that's very unnatural. I recognize that, but at the same time, it's necessary. If you have a very delicate repair, this is even more critical. If the repair is a small repair and the tissue is good, there is some wiggle room about how much you can do. But in general, we want you not to do any activity. It's very hard to have somebody use certain parts of the shoulder and not others. So in general, because we know the rotator cuff function is to initiate arm movement, we know that any kind of activity to bring your arm away from the body is going to pull on the rotator cuff and pull on the rotator cuff tear, and that's what we don't want. So there's one concept I want to stress over and over as to why this video is here for, is to protect the repair and to keep what we fixed intact. Because ultimately, the process of rotator cuff healing is a race between the mechanics that we naturally want, which is we want to use it, and the biology. So we want the biology, which means the healing to kick in before the mechanics are going to disrupt it. So everything I'm telling you is really all about how can you relax the rotator cuff, how can you put the arm in a position where the rotator cuff will stay and there won't be excessive tension on it. Because once the rotator cuff pulls off, it's not going to come back. So we want to kind of keep it there. What about with sleeping? People ask about sleeping a lot. When you sleep, we want to use the same concept. We want to make sure there's a pillow or two that's behind the elbow, that's between the elbow and the bed, and then you want to use that so the arm doesn't go back, because as we mentioned before, that's going to put stress on the front of the rotator cuff over here. If you get this pillow, some people love this and some people hate it. You can actually use it back here if you want to. You can use it back here if you want to. Some people like to put it inside over here like this. If you need to do that, that's okay to do as well too. Just kind of carefully scrunch it inside there. And some people like that a little bit better. That does help. Some people don't like it. So I don't think there are any strong rules with that. If you like it and it helps you, you can use it. If not, I'm okay without it. To achieve pain control, you can actually apply, whether it's cold packs or heat packs, although in the beginning probably cold packs are a little bit better. Just make sure that you don't put it on for too long. You can sometimes get cold burns. You can get this from any drugstore. And this really will help to control some of the pain as well too.